Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. Now you're looking at this image and you're like, what's that little protuberant hump there? I bet it's a lipoma. We're going to be discussing this and much more in this presentation on soft tissue tumors pathology. This is covered in your book, Medical School Pathology and Step 1 Review. You can scan the QR code to get to the updated material, but you already know that. Now, soft tissue tumors pathology starts with lipoma. A lipoma is a benign tumor composed of adipose tissue that typically develops just beneath the skin. To the right here, we can see the histologic presentation of a atypical lipoma, but I want you to notice is all the white space, that is fat. Now, lipomas are most commonly seen in adults. To the right here, we can see an x-ray that showcased the lipoma, marked by the arrowheads. Fortunately, lipomas may be treated by surgical excision. As you can see here, this was a picture taken from a patient who had multiple lipomas removed. Definitive diagnosis of lipoma is made by pathology, showing a well-circumscribed mass composed of benign adipocytes. To the right here, we see large amounts of fibrous tissue associated with adipose tissue. This is a fibrolipoma, which is a subtype of lipoma. And here we have a physical exam finding in which you should have lipoma on your differential. And here we see a slide of normal cardiac tissue on the left, lower side, and a lipoma on the right upper stained slide of an H&E. This is a rare case of an intracardiac lipoma. And here we have a lipoma that was associated with a specific specimen. Looks like it is from the GI tract. Yes, this is a duodenal lipoma. Now, liposarcoma is malignant. Liposarcomas are malignant tumors of adipose tissue. To the right here, we have a myxoid liposarcoma. Liposarcomas are very rare compared to lipomas, their benign counterparts. Liposarcomas may metastasize. Adults are more commonly susceptible to developing liposarcomas compared to children. Definitive diagnosis of liposarcoma is made by pathology, showing malignant proliferation of adipose tissue. Lipoblasts are the characteristic cells seen in liposarcoma. Treatment of liposarcomas involves surgical excision. Now here we have a photomicrograph showing characteristic liposarcoma histology with juxtaposed well-differentiated and dedifferentiated areas of the same tumor. And here we have higher magnification of liposarcomas. Note the lipoblasts and the univalculated adipocytes and the atypical spindle cells. And here we have a micrograph of dedifferentiated liposarcoma. And here we have bone formation within a liposarcoma. and an ultrasound of a supposed liposarcoma, and more histology of liposarcoma. I'd like to guide your eyes to the right panel. Look at that cell. That is not a normal adipocyte at all. Liposarcoma. And more liposarcoma. This one's a myxoid liposarcoma. And more liposarcoma. You see all those dedifferentiated cells, right? And the adipocytes that are abnormal. Now, rhabdomyoma. Rhabdomyomas are benign. That's right, benign tumors composed of skeletal muscle. To the right here, we can see a photomicrograph of a fetal type rhabdomyoma. Note the plump, pink, benign skeletal muscle cells. Now, rhabdomyomas can develop in heart muscle, termed cardiac rhabdomyomas, which are associated with tuberous sclerosis. Now, although rhabdomyomas are uncommon in general, they are the most frequent kind of cardiac tumor among infants and young children. Here we have a surgical specimen that was removed from a patient showcasing a rhabdomyoma. And then we have some histology at various magnifications of a rhabdomyoma. Note the muscular tissue. Now, rhabdomyosarcoma. Rhabdomyosarcomas are malignant tumors composed mainly of skeletal muscle. To the right here, we have a photomicrograph showing nodules of tumor cells that are separated by hyalinized fibrous septate. Now note this discohesive large tumor cells with very dark blue nuclei and scant cytoplasm. This is a alveolar rhabdomyosarcoma. Rhabdomyomas typically affect skeletal muscle or occasionally hollow organs like the bladder or uterus. And the diagnosis of rhabdomyosarcomas is made by histology showing malignant skeletal muscle with rhabdomyoblasts, which are the characteristic cells of rhabdomyosarcoma. Pathology stains for rhabdomyosarcoma will be Desmond stain positive. Now, rhabdomyosarcomas often involve the head and neck in the majority of patients, but the vagina is the classic site in young females. And with that, you completed another presentation. Give yourself a pat on the back. You're doing such a great job. You know so much. You should be proud of yourself. I'm proud of you. Good job. Until next time, take care.